Hello friends, today we are looking at pulmonary tuberculosis. So this is the one of the conditions that are much common, and they are very sensitive in the sense that you need to have a solid understanding on this condition. So pay attention as we are moving on to look at what is it that tuberculosis is and what causes the pulmonary tuberculosis. We are going to talk about the pathophysiology of this pulmonary tuberculosis and the possible clinical manifestations that you are going to see in this condition. Straight away, let's talk about what is pulmonary tuberculosis. So in this definition, there are some of the key terms that you shouldn't have to leave out as you are describing what this pulmonary tuberculosis is. So in this case, we are saying that pulmonary tuberculosis is a contagious and potentially fatal infection caused by the airborne bacterium. What do we mean by this? First thing, you need to understand that this is a contagious condition. When we say that, we mean it is highly communicable or is an infectious disease which can be easily transmitted from one individual to another. And we are saying that it primarily affects the lungs. That's why we are saying pulmonary tuberculosis. Pulmonary, we are referring to the lungs. But it's not that it is going to be confined to the lungs only, but it can also be spread to other body structures or body parts like the meninges, the kidneys, the bones, the lymph nodes. All these structures, we are going to find that they are, at the end of the day, they are going to manifest with the pulmonary tuberculosis. But primarily, this is an infection that is found in the lungs. Having looked at what pulmonary tuberculosis is, what causes pulmonary tuberculosis? One time or the other, you're going to face the question that will require you to describe the causative agents of this pulmonary tuberculosis. Quite alright. Pulmonary tuberculosis has a number of causes. There are types of bacteria that can cause pulmonary tuberculosis. The first one is Mycobacterium tuberculosis. This is the most uncommon bacterium which causes pulmonary tuberculosis. And we are saying that it's an aerobic rod-shaped organism. It is very sensitive to heat and ultraviolet rays. Another organism that can cause pulmonary tuberculosis is Mycobacterium bovis. This actually it is found in animals, mostly when the person takes the meat or milk, and pasteurized milk of an infected animal is going to manifest with the pulmonary tuberculosis. So it's the type of mycobacterium which can be transmitted through or between the animals and human beings. The other causative agent is Mycobacterium avium, though it is a rare cause of tuberculosis. So these are three etiological agents that can result in pulmonary tuberculosis. After looking at what causes pulmonary tuberculosis, you also need to know the modes of transmission. Why is it like that? If you know the modes of transmission, you are going to be able to prevent this spread of condition. Why are we saying so? That you are medical students, at one time you need to give an IEC. You need to talk about how is it that you can prevent pulmonary tuberculosis from being spread from one individual to another. But if you do not know how this condition or how this agent, the causative agent of pulmonary tuberculosis, is transmitted from one individual to another, it is going to be a problem or a challenge for you to prevent the spread. So we're saying that mostly this Mycobacterium tuberculosis, it is an airborne agent or bacterium which can easily be transmitted through air. So having that in mind, you need to know that it can easily be spread through coughing, through sneezing, through talking, anything that is going to make the air for being exhaled from one individual. It is going to stand as a mode of spread. So even you as a susceptible host, you can easily acquire this pathogen through inhaling contaminated air. And we are saying that this bacterium can easily remain in air for a long period of time, or even in dust, just in a sense that when a person swallows the dust which is contaminated with this bacterium, can easily get pulmonary tuberculosis. And it can be spread through to other parts of the body, just like we have mentioned. It primarily affects the lungs, but not only confined in the lungs, but also can be spread to other body structures like those that have been mentioned in our inquest. Again, there's a bovine tuberculosis, just like we have mentioned. This one can be contracted through ingestion of unpasteurized milk, through eating of improperly cooked meat of an infected animal. This can be the mode of transmission. So having known the mode of transmission, you are going to be able to put implementations that are going to stand as the preventive measures from this transmission of pulmonary tuberculosis. Why is it that we need to pay much attention on the preventive measures? Because if you've noticed, we say that it is highly contagious and it is a fatal disease, to mean that if at all it is left untreated, it can result into death. By so doing, we have to pay much attention on how we can prevent this condition. There are types of tuberculosis in terms of classifications. There are 4 or rather 5 classifications of this pulmonary tuberculosis, and we need to be able to know these classifications because that's going to help us to know the appropriate intervention that we need to put in place in order to manage it. Because this tuberculosis, or rather the Mycobacterium tuberculosis, which causes pulmonary tuberculosis, sometimes it may remain resistant to some drugs. Hence, we need to be able to classify them so as to be able to put appropriate antibiotics that is going to eradicate the presence of this Mycobacterium tuberculosis. The first class is said to be class 0. When you say class 0, this is the person who has not been exposed to TB and is not infected. And how can we conclude that this person is not infected? When you take the history from this patient, you find that he has never become in contact with the person who is infected. Try to take the test, which is called the tuberculin skin test. You are going to find that it is resulting negative. By so doing, we are saying that this person or individual is going to be classified as class 0. We also have class 1. Class 1, this is an individual who is exposed to tuberculosis but no evidence of having an infection. And in terms of description, we're saying that the person will have an history of exposure, but the result, the tuberculin skin test, it is going to come negative. And what do we mean that this person has been exposed? For example, let's say you live together with a person who is having tuberculosis. There are high chances of an individual to contract tuberculosis in that case. So we are saying this person is exposed, but does not have any evidence of having an infection. So we are going to classify this kind of an individual into class 1. There is also class 2. Class 2, this is a person who has been exposed, and when you do the tuberculin skin test, it is going to become positive, but the person is not having the disease. What do we mean by this? There's a presence of an infection without the disease. What we mean is that when you do the test, you do the diagnosis, the investigations, you are going to be able to come up with the presence of Mycobacterium tuberculosis. But the person is not presenting with any clinical manifestation that can rule or guide you to classify this as a pulmonary tuberculosis. So this is what we mean in this case. From there on, we've got class 3. Class 3, this is a clinically active tuberculosis. The person, even without carrying out the investigations, you are going to be able to see manifestations that is going to evidence the presence of pulmonary tuberculosis. So we are saying that the tuberculin skin test is going to come positive, the tuberculosis culture is going to become positive, and also the radiographic evidence is going to be there, where you find even the bones there's a presence of Mycobacterium tuberculosis that is going to rule the infection. Class 4, this one, it is very complicated or confusing class of tuberculosis, because you are not going to have the clinically active TB, but the person will have the history of episodes. What we mean by this case, you find that the person at once was infected and had a clinically active TB. After receiving the treatment, this tuberculosis may subside. After some times, the TB multiplication takes place. It is going again to elicit the inflammatory process, and the manifestation is going to be evidenced. In this case, we are saying that it is going to be clinically inactive when the person is having the Mycobacterium tuberculosis. Hence, there is a history of episodes for TB. These are some of the classifications in which we group TB according to the severity or intensity of the condition that a person may be presenting with at a particular point in time. Having looked at all that, we need to understand the predisposing factors. Remember, we talked about the etiological factors, but what can influence the occurrence of pulmonary tuberculosis in an individual? Why is it that we have situations whereby one individual is not having pulmonary tuberculosis at an expense of another? That's why we're saying they are predisposing factors. They are not primarily the cause, but they influence the occurrence of pulmonary tuberculosis, which is a contagious and the fetal conditions. Quite alright. The first predisposing factor is poor housing. How can this influence the occurrence of pulmonary tuberculosis? Remember, we talked about it being an airborne disease that can be spread through air. So if at all you live in one house with a person who is having pulmonary tuberculosis and the house is poorly ventilated, it means that the air that is going to be expelled or exhaled by this person who is infected, it is going to be circulating in the house, and then you'll be able to exchange that air containing the bacterium. Hence, you are going to increase the chances of you being infected with pulmonary tuberculosis. The second predisposing factor is poor nutritional status. Remember, pulmonary tuberculosis can come as an opportunistic infection, whereby it's going just to take advantage of the person who is having immunocompromised, whereby if at all you lack a resistance to this infection, you are failing to withstand its presence, you are going to be infected by this Mycobacterium tuberculosis. The other predisposing factor is overcrowding areas. This just increases the chances of you having in contact with a person who is infected by tuberculosis. Hence, you are going to be exchanging the air that is contaminated with mycoplasmic tubercle bacilli. And we're saying that examples of these overcrowded areas, it could be the markets, the schools, or any other areas where people, they do meet one with another. Another predisposing factor can be age. Just like we have mentioned, we're not talking about what causes, but what influences this occurrence. So for example, age, we know that as age advances, the person loses the immunity. And we can also talk about infants who have not yet matured in terms of their immune resistance. So the pulmonary tuberculosis, when it is inhaled with such kind of an individual, the person is going to fail to withstand and defeat its presence. Rather, it is going to manifest the disease and produce the clinical manifestation of the conditions. Another predisposing factor can be smoking. The smoke itself, it has an impact direct to the lungs. And if you've noticed here, we are saying that the smoke destroys the lung, resulting in parenchymal dysfunction, leading to disease like tuberculosis. What do we mean by this? You find that the key functions of the lungs, the structures of the lung, which plays the role function of it in gaseous exchange, it is going to be weakened or altered in terms of its function by the smoke. And when the tuberculosis is inhaled, it is going to defeat this individual due to the fact that there is no defense mechanism. Alcoholism, the impact is just the same as the smoke. And there are some drugs that a person may be taking due to some conditions, other underlying conditions, sometimes even just drug abuse that have got a mechanism or the component that suppresses the immune system. This has the direct impact in making the person be prone to the occurrence of tuberculosis. Remember, we said that it can come as an opportunistic infection whereby it can result in an individual who is having immunocompromised. So you find that two individuals have inhaled contaminated air, but one is not going to manifest with pulmonary tuberculosis, whilst the other one is going to manifest with this condition due to the fact that there's immunosuppression. And we're saying that drugs, they can elicit this impact. And sometimes it can be the diseases, more especially the chronic diseases like HIV or AIDS, like cancer. These have got the direct impact because they do reduce or limit the immunity of the person and making more prone of that individual failing to withstand the presence of bacterium or to defeat its presence, hence resulting in pulmonary tuberculosis. Having looked at all that in mind, we need to know the pathophysiology of pulmonary tuberculosis. When we say pathophysiology, what do we mean? In this case, we are talking about how is it that this pulmonary tuberculosis as a condition, it is going to alter the physiological function of the body. First thing you have to put in your mind is that what is the function of the lungs? Remember, a lung is the primary or a key organ of respiration. So anything that is going to alter the lung, it means that even gaseous section, the respiratory system, it is going to be impaired. And once one system is impaired, it means that the whole body is going to manifest with the complications and the disturbances. Because remember, respiratory system is the way oxygen is transmitted or transported and distributed to all parts of the body for tissue perfusions. So once there's a problem with oxygenation, it means all the systems in the body are going to be affected in one way or the other. Now let's talk about the pathophysiology of the pulmonary tuberculosis. First thing, we need to have a susceptible host who is going to inhale the bacterium. And when this bacterium is inhaled, it is going to be deposited in the alveoli of the lungs. And we are saying that the primary site of infection in the lungs, it is called the gonfocus. So sometimes you may be asked, what is the gonfocus? In this case, gonfocus is nothing but the primary site where the infection in the lungs is going to occur. So we are first saying that mostly you find that these gonfocus are going to be found in the upper part or the lower lobe, or in the lower part or the upper lobe of the lungs. Why is it like that? Because we said that this is actually the aerobic Mycobacterium, to mean that it needs oxygen for its survival. So it is going to be found near where oxygenation takes place, like in the lobes, in the airway tract. So that's where we're going to find this bacterium. So after that, you find that the bacterium, it is going to be detected by the dendritic cells. In the very gonfocus, it is going to be detected by the dendritic cells, which act as the detectors of foreign bodies. So when these dendritic cells, they detect this presence of the bacterium, it is going to coat it, it is going to bind to it, and transport it to other parts of the body. But the function of these dendritic cells, they are going to inhibit replication of the Mycobacterium tuberculosum so that it cannot grow in number. But due to the fact that these dendritic cells are having an access to the blood, they can spread this Mycobacterium to other parts of the body. And it is going to be spread through the circulatory system, primarily in the blood or the lymphatic system. So tuberculosis as a condition, it is classified as one of the granulomatous inflammatory conditions, to mean that it is one of the conditions that has a capability of forming the granuloma. And the question will click, what is this granuloma? In this case, when you say granuloma, we mean the aggregation all the leukocytes, or all the cells that are essential for the phagocytic mechanism. Those cells that are essential in the defense mechanism, they are going to aggregate together in order to play its role of defeating the presence of foreign bodies that may attack the body. So what are these cells that we're talking about? It could be the macrophages, the T lymphocytes, the B lymphocytes, and the fibroblasts that work together to combat the presence of the bacteria in the body. So when this happens, the lymphocytes are going to coat or to surround the infected macrophages that have caught the bacterium inside. Now, what's the function of this granuloma? Having said what is it all about, but what's the function? The first function, it prevents the dissemination of the Mycobacterium. How does it do so? It surrounds it. It's more like it engulfs the bacterium so that it is prevented from being disseminated or being spread to other structures of the body. And the second thing, it is going to provide the local environment for communication of the cells of the immune system, because immune cells, they are going to be produced in the body by the presence of these foreign bodies, but the bacterium has the capability of hiding itself in a sense that it can't be digested or destroyed by the immune cells. But this granuloma, it is going to make it more prone to be in contact with the immune cells. So if it do, this is a susceptible person, you find that even if the granuloma is there, but it's going to fail to defeat it, to destruct it. But if at all this person is having good immunity, you find that the bacterium, it is going to be defeated, and it's going to end here because digestion, it is going to take place. Let's move on. So we are saying that within this granuloma that is going to be formed, there are T lymphocytes that are going to secrete the cytokines, like the interferons gamma. These interferon gamma, they've got the capability of activating the macrophages inside the granuloma to destroy the bacteria. You heard that? That's why we say that the granuloma, it is very actually important. So you find that even after this happens, it's not always that bacteria are going to be destroyed, or it's not all bacteria that are going to be destroyed, due to the fact that we say that this is a susceptible person who is prone to the manifestation of the tuberculosis. So when this happens, the bacteria fails to be distracted, or the immune system fails to defeat the presence of the bacterium, it is going to result in these bacteria to become dormant. And when they become dormant, they are going to result in latent infection. That infection now, it is leading to the production or producing the manifestation that we are going to see in the person who is infected by pulmonary tuberculosis. And the destruction of the bacterium, it is going to lead to cell necrosis. What are we saying in this case? We say the macrophages are going to surround the bacteria. So when the immune cells comes, they are not going just to destroy the bacteria, but also the cells that are surrounding the bacteria that are infected are also going to be destroyed. And that destruction of the cells of the body is what we call necrosis. So when there's a necrosis that has taken place, plus the digestion and destruction of the cells, which is the bacterial cell, it is going to lead to the formation of the cheese-like matter, which is termed as a caseous necrosis. So if we ask you, what is this caseous necrosis? Actually, this is the combination of the necrotic matters plus the destroyed bacterium that is going to be formed in the distracted tissues in the lungs or any other body structure that is going to be infected by this mycoplasmic tuberculobacilli. So if TB, or rather this Mycobacterium tuberculobacilli, fails, or the immune system fails to destroy the Mycobacterium tuberculobacilli due to the fact that this is a susceptible person, this bacterium is going to be introduced in the blood stream from the gone focus. Remember what we said this gone focus is, to which we said is the primary site of infection. So they are going to move from the gone focus into the blood stream. From the blood stream, it is going to be spread to all parts of the body now, like the meninges, the bones, the lymph nodes, those organs that we talked about. That's why it is possible to find the presence of this Mycobacterium tuberculosum in other body structures rather than just in the lungs. And when this happens, it is going to produce or elicit the foci of infections in these structures that are going to be infected. And when that happens, they are going to result in the condition that we call miliary tuberculosis, and mostly it affects the infants and the elderly people. Why is it like that? The rule or the principle of immunosuppression, it comes in play. So because of the immunocompromised of these groups of people, you're going to find that they are going to result in miliary tuberculosis. So the affected tissue or the lungs are going to be covered by this cheese-like matter that we have talked about, which is the caseous necrosis, because there's been the production of this material due to the destruction of the Mycobacterium tuberculosis and the necrotic cells. And actually this is what is going to make one of the signs and symptoms of pulmonary tuberculosis, where the person expectorates the sputum, which is purulent and is yellow thick matters from this caseous necrosis that we are talking about. So we're saying that mostly you find that after this cheese-like matter has been formed, the TB becomes active, just like the class 3 that we talked about of TB. You're going to find that the cavities that are going to be formed by the destruction of the tissues in the lungs are going to be joined with the airway passage, like the bronchi. So when they joins, then you'll find that when the person, it is going to induce the coughing mechanism, where the person will be able to expectorate the purulent sputum that we are talking about. And this sputum, it contains microorganisms or the bacteria. That's why it is going to be possible for this person to exhale the bacterium that can be spread to other individuals. That's why it is said to be the airborne disease. Why is it like that? Because it is going to be expectorated from the airway tract due to the fact that there is a combination between these cavities that are going to be formed and the airway, which are bronchi in this case. But when a person is given the proper treatment, like the antibiotics that the person can be given, we find that it's going to combat this infection and the healing process is going to take place. But this healing process is going to leave the scars. There will be the scar formation due to the fact of destruction in the lungs. But if at all it remains untreated, it is going to result in a complication that we call lobar pneumonia. That's why it is very much important to have the treatment of this bacterium. There are many antibiotics that you can use. In the next lessons, we are going to talk about the treatment of pulmonary tuberculosis, where we're going to talk about antibiotics like lymphampicin, ethambutol. We are going to talk about pyrazinamide. We're going to talk about streptomycin. All those, we are going to look at its impact, their action, their side effects, and the nursing implication that you need to put in place as a member of a medical team. Let's move on. Having looked at the pathophysiology, we have seen how this pulmonary tuberculosis is going to manifest and alters the physiological function of the body. Now, what are the possible signs and symptoms? Just from the pathophysiology that we have talked about, you have to be able to come up with the signs and symptoms that can be seen in this situation. So, for example, we say that there will be the combination or there will be joining or the cavities containing the cheese-like matter called caseous necrosis plus the bronchi. This is evident that you are going to have the cough. It is going to induce the cough which will be containing the Mycobacterium tuberculosis, and usually there will be the expectoration of the purulent sputum. And at the end, you can have hemoptysis, which is the expectoration of the sputum containing the bloody stains due to the destruction and erosion of the blood vessels. The person also going to manifest with the chest pains due to the destruction of the lung tissues and exposing of the nerve endings. So when this happens, there are going to be the pain that will be experienced by the person who is having pulmonary tuberculosis. And it's also evident that we have dyspnea. Dyspnea in this case will we mean the difficulties in breathing. Why the person can have the difficulties in breathing? Because there will be the destruction of the blood vessels, there will be the inflammatory process in the lungs, and remember the signs and symptoms of inflammation, where there will be the accumulation, there will be tumors that is going to be formed, and the tumors, of course, it is evident that the person will have difficulties in breathing, and the breathing will be shallow due to the failure of the lung to expand. Who have fever. Fever, it is going to be produced due to the antibody antigen reaction that is taking place due to the presence of this Mycobacterium tuberculosis in the body. The person also manifests with fatigue due to the increased ATP requirement of the cells in order to combat the presence of the bacterium. Also, weight loss can result due to anorexia that can happen in the person who is having this pulmonary tuberculosis. So we said that having known the predisposing factors, it is going to help you to understand how you can prevent the occurrence of this pulmonary tuberculosis. Remember, our goal is to prevent the occurrence of infection, not only to cure. We have to start with promoting, we prevent. When we fail to prevent, that's when curing is going to occur. But in this case, let's try by all means to prevent the occurrence of this pulmonary tuberculosis. But how are you going to prevent that? Having knowing that it's airborne disease, you are going to isolate the patient from other patients in the wards. It has to be nursed alone in an enclosed room so that you can prevent others from contracting this infection. You can also give an IEC whereby they have to use the masks, or maybe you teach on how to cough by covering the mouth. You can also impose the disinfection of the sputum when it is being expectorated before being disposed of. When you do that, you are going to promote the prevention of pulmonary tuberculosis. And you also have to restrict visitors. The family members and relatives would like to visit their patients in the ward, but you have to explain why is it that you are restricting their visitation so as to promote the preventive measures. You don't want them to acquire this infection too, having that it is a communicable infection. And the possible complications that may arise, there will be immediately TB, just like we have mentioned in the pathophysiology. What is this all about? Then you can also have the respiratory failure due to the fact that the lung expansion is going to be altered due to the accumulation of the caseous necrosis. And we're also going to have pleurisy with effusion. In this case, we are talking about the fistula that is going to be formed between the lungs and the pleural cavity. So there will be the spilling all the fluid from the lungs to the pleural cavity, causing the inflammation, and you have the pleuritis. You can also have atelectasis due to the fact that there will be the destruction in the lungs, and there will be the formation of the cavities that is going to make the lungs fail to play its function. You're also going to have the pneumothorax. This pneumothorax is going to result from the rupture of the peripheral cavity or the pleural cavity, and it can also lead to the formation of bronchopleural fistula, the openings that are going to be formed from the lungs to the pleural cavity, and making gaseous exchange be a problematic to take place. And this is going to alter all the organs in the body because they are not going to be able to receive sufficient oxygen. Hence, pallor and cyanosis can be an evidence. You also are going to have bronchiectasis due to the obstruction of the bronchi. Remember, we said that this gone focus mostly it is going to be formed near the lobes, whereby there will be an inflammation in the bronchus. Hence, there will be the stagnation or the impairment in terms of the bronchial function. We are also going to have the tuberculosis pneumonia as one of the complications of pulmonary tuberculosis. This is the end of today's lecture. Thank you very much for your participation and your attention for listening to this lecture. Please don't forget to like, give comments, and also share the videos. Not forgetting to subscribe for more videos. When we send the other videos that will be helpful for your exams and for your knowledge as a medical student, you have to be able to have an access to them. So for you to do that, don't forget to subscribe. Thank you.